question that we have is, can malignant mesothelioma be
Oh.
diagnosed early?
I think malignant mesothelioma can be diagnosed early if you have known asbestos exposure. Recently, we took care of a woman who had mesothelioma, and she had her father had passed away from mesothelioma. Her biopsy came back positive. She has 3 other sisters. They all got tested. I think 2 of the 3 sisters were diagnosed early disease. So when you have a family history, it's easy to kind of watch and screen. Oftentimes it's a difficult diagnosis if it's just one person, like Dr. De Silva said, if you're young or, something just seems astray. But if there's any sort of family history, I think that's a big red flag. Ellie?
Yeah, the exposure to asbestos too is, is proven. That, and the exposure could be anywhere from 20 to 50 years ago. So, you really have to kind of think about it. And and I think another point is Memorial Day was yesterday. A third of all meso patients diagnosed in the United States are veterans, and that's they're tracing that back to the exposure to asbestos on the ships and all that. So I think I don't think there's actually a test that you can say, okay, I'm going to get an early test for mesothelioma. It's just a lot of warning signs and family history, like Lisa was saying, and like Dr. De Silva was saying, when something doesn't make sense, that's usually, that can be the reason. So, I mean, but there is no per se, test to say, okay, you're going to get mesothelioma in 20 years, 30 years, 40 years.
All right, so going along with that, I guess, what kind of signs and symptoms should family members and people be looking for?
Well, pneumonia. A lot of times, people are diagnosed with pneumonia and they don't get better. We've also noticed, it seems like some people, get injured, and then, they might fall or play tennis. We've had a couple of people that, were playing tennis or doing something, and they would fall and end up with fractured ribs and just never got better. So that's, the symptoms, like Dr. De Silva was saying, it's like shortness of breath, pneumonias that don't get better, pain. Sometimes it's a dry cough.
Yeah.
And effusions, and and
breath.
Yeah, and just don't feel right. Some people just don't feel right. And pain sometimes, and sometimes not. Sometimes people can present with pain, and sometimes people say they didn't know they had anything wrong with them except their chest X-ray was, there was something wrong with their chest X-ray, and that they also, kept having pneumonias and it wouldn't go away.
Thank you. So next, I guess, what is the typical treatment then for mesothelioma?
So,
go ahead.
Often the treatment is that you'll go to your primary care physicians with, like Ellie said, chest pain, back pain, shortness of breath, dry cough. You might get a chest X-ray, like Dr. De Silva spoke about. There might be a pleural effusion or water around the lung. They might drain it. 50% might come back negative, but it reaccumulates, and that kind of raises a red flag, and then they might have to go for a biopsy. And again, sometimes those biopsies come back negative, but usually they're followed with CT and MRIs, and once they're diagnosed, it's they have to figure out how advanced the mesothelioma is. Is it gone into the lymph nodes? Does it, and that's through a small incision through your, right in your chest, and they stick a scope in. It's a very quick procedure under general anesthesia where they check to see if the lymph nodes have been involved. If they have been involved, then they offer chemotherapy first to shrink back the tumor, and then they would opt to take you to the OR and see if they can remove the tumor from your lung, maybe a pleurectomy or an extrapleural pneumonectomy. And again, there are everybody's treated differently, just like everybody has different fingerprints. Um, sometimes you take them to the OR and you think you're going to do one certain sort of procedure, and uh, it's a different game plan once you get in there. So you get chemo, or maybe you don't get chemo, and then you go to the OR and you can become an operative, and then you have to recover from that, and sometimes it's followed with chemo or radiation as well. It really does depend upon how advanced the disease is and what other kind of past medical history you have. Do you have a healthy heart? Do you have other comorbidities that go along with it? So each person is treated very individualized. It's not like everybody who has mesothelioma is going to get this procedure. It's very individualized according to what your needs are and what obstacles that you'll have to overcome.
Thank you.
So the question, the typical treatment, and as like Lisa was saying, in this day and age, there really isn't typical treatment. Everyone is treated differently. A lot of it also depends on your functional status, which is, functional status is how, can you take care of yourself? Can you participate in care? Are you able to, cough and deep breathe? Are you able to ambulate? Are you able to, assist in your treatments? Yeah. So maybe, when people say typical treatment for meso, that's why you really need to go to see a specialist like Dr. De Silva or many of the ones that are around the country, because there's always something new happening with it, and it's not stagnant. It's not you can't. 2 years ago treatment might not be what they're doing right now. That's again, there's a lot of times people get diagnosed and they don't go to a meso center, and you're not doing yourself any favors by not going, because especially in the United States, there's enough of them around, and there's enough professionals that are dedicating to their life, and they are making gains in this, so that you really should seek out somebody like a Dr. De Silva or a center. Don't you think, Lisa?
I agree, yes.
Mm-hmm.
I think going to a specialist is key.
Yeah.
Once you've been diagnosed, you want to find somebody who is very well versed in this disease process.
Yeah, and like we were saying earlier, it's also a team. You want a whole team that's, this is what they do. This is what they're functioning. This is what they're focusing on. This is what, they're up on the newest things, and they know the clinical trials, and they know, what might work for you. Whereas someone, a primary care physician who might just see it once or twice in their career and is relying on, the latest published data, might not know that, there are clinical trials, through no fault of their own. Whereas, the centers are much more specific and much more, oh, there he is.
Hello.
Hi.
Hi, Dr. De Silva.
I'm back. I lost my connection as I drove in. So we left at the early diagnosis, right?
Yeah. Yeah. So.
Okay. So really is, for us, the most important thing is staging. As we all know, there are 4 stages for mesothelioma: 1, 2, 3, and 4 stages. So stage 1 and stage 2 are considered early stage. And really, unfortunately, most of the patients, when they show up with advanced stage. What's important is early diagnosis. So you have to have a clinician, or a physician or family practitioner, whoever it is that's seeing that patient early in the game, to be more invasive, more assertive what it is that he wants to be done. A lot of times physicians are concerned that doing invasive procedures will add to the patient pain and suffering, which is not really true. We can do a biopsy today in an outpatient setting, same day, in and out of the hospital, minimal pain, but have really good tissue diagnosis. And early diagnosis is the best treatment. That's what I tell. When it gets to mesothelioma, early diagnosis is the best treatment, and that followed by multimodality therapy in early stage. But when they show up with advanced stage disease, 3 and 4, then it's more challenging.
So I guess then my next question would be, how can one ensure early diagnosis?
Right. So you really have to be. Patients shouldn't take a no for an answer. That's where I think the one point that I try to make. I go around the state in Illinois giving lectures about mesothelioma, and I tell patients and I tell physicians, don't take no for an answer. If you do a puncture and a drainage of fluid and the result is negative, but the pleural effusion doesn't go away, don't accept that as being negative. Then you have to step up your procedure, either by a fluoroscopy or by a CT guided needle biopsy, ultrasound guided needle biopsy. You need to start invading the patient. Yes, there's more pain and suffering. It's an invasive procedure, but the price is much better if you don't. I think as soon as you get something suspicious and the diagnosis is negative, but the effusion doesn't go away, don't take that as a no answer. Just pursue other invasive procedures.